it. I will make the okay.
So hello everybody from Greece and abroad. We are very honored and very, very happy to have today as our speaker and invited person of such significance, such as Professor Harold Koenig, that we are all excited to hear some of his extensive work on religion, spirituality, and health, and the type of research and clinical applications. Professor Koenig started from Stanford University, moved on to UCSF to get his medical degree, then continue at Duke University, where he faithfully stayed and serves now as professor of psychiatry and associate professor of medicine. Obviously, his contribution goes beyond Duke, and he does have several appointments, not only in Europe, in America, but also in Africa, in Saudi Arabia, and in China, where he teaches and conducts research. As some of you know, Dr. Koenig is the founder and director of Duke's University Center for Spirituality and Theology and Health. And of course, we all have read his publications and have seen the several book chapters and book. He's the main author. He was the editor-in-chief of the International Journal of Psychiatry and Medicine, and currently he's the associate editor of a very significant journal published by Springer, the Journal of Religion and Health. His research in religion and health has been featured on many, many national and international TV news programs, and he is the one that has given testimony before the US Senate and later before the US House of Representatives concerning the benefits of religious involvement on public health. He has received numerous awards, among which the 2012 Oscar 5-Star Award from the American Psychiatric Association, the Gary Collins Award, and recently the Frank Minirth Award for Excellence in Christian Psychiatry and Behavioral Medicine from the American Association of Christian Counselors. We all wait to have in our library his new book, Handbook of Religion and Health, the 3rd edition, which is produced with Dr. Tyler Van der Wiel and Professor John Petit, who we also had the honor to have with us before. With that, I would ask Professor Koenig to take the podium, and we are all looking forward to listen to his presentation. Thank you again so much.
Thank you, Dr. Linus. It's been a real pleasure getting to know you and all of the wonderful work that you have been doing. And it's a great pleasure to be able to speak to your audience today. So I'm going to go ahead and share my screen, and then I will provide a presentation, and then we'll have some time for questions. And I look forward to answering some questions that you might have about this area. So I will go ahead and share my screen now. And then begin here from the beginning. Okay. So there we have it. So my topic today will be religion, spirituality, and health research and clinical applications. So a bit of an overview. First, I'll be talking about the definitions of religion versus spirituality, then review research on the connection between religious involvement and mental health, and then look at physical health as well, the connections between religious involvement and physical health, describe a theoretical model that will illustrate how religious involvement affects a person's health, provide some clinical applications, and then some conclusions and some further resources for those who want more information about this area. So are religion and spirituality the same, or are they different? This is a very controversial issue today. On the one hand, religion tends to be unpopular and potentially divisive because people believe different things and they believe those things passionately. Spirituality, on the other hand, is popular, it's inclusive, it's common to all. However, it tends to be self-defined because no one can really come up with a common definition. Throughout most of recorded history, spirituality and religion have been considered the same thing. Within the past 30 years, however, with secularization, spirituality in academic settings has become separated from religion. So the issue is that spirituality has been changing over the last 30 years, and its definition has been expanding. So I'd like to illustrate how that's occurred. So here's the traditional understanding of spirituality. The spiritual person, through most of recorded history, has been the deeply religious individual, the person whose life centered on and revolved around their religious faith. And then there were the more superficially religious people, those for whom religion might have been somewhat important, but it was not the center of their life. And then those who were secular, who pretty much wanted nothing to do with religion or spirituality. Now, as we look at the health of these various groups, it was fairly simple to study this. You could give a religiosity scale, and those who scored high on the scale could be compared to those who scored lower on the scale and those who scored at the very bottom of the religiosity scale. And you could look at their mental health and both the positive aspects of mental health, the negative aspects, and also their physical health, because we know that mental health is connected to physical health. Now, this is the current definition or the more modern definition of spirituality. So spirituality has expanded beyond religion. So these individuals describe themselves spiritual and religious. These individuals over here describe themselves as spiritual but not religious. So now spirituality has grown beyond religion, and there is a group of people who describe themselves as spiritual but not at all religious. And then though there are individuals who indicate that they are neither spiritual nor religious. And again, you can compare the health of these various groups. Are the spiritual but not religious individuals, are they as healthy as those who are both spiritual and religious? And are these individuals any healthier than people who are neither spiritual nor religious? And again, you can look at their mental health, the positive aspects, the negative aspects of mental health, and their physical health as well. And you can compare the groups. Now, spirituality has yet grown even further, and this is the current definition of spirituality. It's grown to actually include aspects of mental health, such as meaning and purpose, connectedness with others, existential well-being, peace, etc. So now the challenge is that when you compare the mental health of the religious and spiritual, and those of the spiritual but not religious, with the secular, these poor secular individuals have no chance to compete because the definition of spirituality has actually included mental health. So those who are spiritual, they have been defined from the beginning to have good mental health. Now, the problem here is that that makes it very difficult to look at the association between spirituality and mental health, because spirituality defined like this will always be related to good mental health. There's really no way to interpret those associations. And for that reason, we have focused primarily on religion and looking at the relationship between religion and levels of religiosity and both mental and physical health. So in discussing the research, I'm going to be talking mostly about religion, which can be measured and which is distinct enough to be able to avoid any overlaps with mental and physical health, which are the outcomes that we're studying here. When measuring spirituality for research, one should use measures that are not contaminated with positive psychological states and traits such as meaning and purpose, hope, well-being, peacefulness. Those should not be used to examine the relationship between spirituality and mental health, because again, they're overlapping concepts, and the results really provide no information that can be useful. Now, quite in contrast, in clinical settings, a broadly inclusive term such as spirituality should be used because it includes everyone, and it can be defined by the patients themselves so as to maximize the clinician's connection with the person and stimulate conversation and engagement. So, the research, we're looking at religion, but in clinical practice, we use the term spirituality because it is so broad and it includes everybody. Okay, so that's how we're going to start here. Let's look at religion and mental health. Now, much of this research, as Dr. Linus indicated, is coming out of the Handbook of Religion and Health, the third edition, which is coming out sometime in late spring or early summer, maybe early fall. It's a huge text. It has 2,000 pages, over 600,000 words, and it extensively examines the research on all aspects of religion and every aspect of health that you could imagine. It has 34 chapters. It has applications for public health as well, which might be useful to many of the viewers here. In the meantime, however, there are a couple of articles that are now out kind of summarizing the research, at least with regard to mental health, in the British Journal of Psychiatry Advances, and also clinical applications in the same journal by my colleagues and I. Okay, let's start with depression. Depression is the most common emotional disorder in the world, and it's especially common among those with physical health problems. There have been, now this research is coming out of the second edition of the handbook, which was published in 2012. So that edition of the handbook is now out, and some of this research, or a lot of the systematic review that I'll be describing the results of here, are coming out of that second edition. But I'll also describe some of the more recent research over the past 10 years. So of the 444 studies that were published in peer-reviewed journals, and these are all quantitative studies, 61% found that religious people were less depressed, recovered more quickly from depression, and responded to religious interventions in terms of reducing depressive symptoms. So 61%, and of the higher quality studies, an even higher proportion found those findings, about 2/3. And of those 444 studies, 6% found that the religious person was experiencing more depression. But if you look at the proportion of studies showing less depression, you can see that there are 10 times more studies showing less depression than more depression. Here's a more recent study out of the Harvard School of Public Health. This involved a 3 to 6 year follow-up study of nearly 10,000 young people, average age of 23. And what they found was that those who were attending religious services at least once a week were about 31% less likely, almost 1/3 less likely to experience a depressive disorder during that 3 to 6 year time period. So they were actually able to predict ahead of time who was developing depression based on level of religious involvement. And those who are more religiously involved were less likely to develop a depressive disorder. Now, what about suicide? There's a lot of research looking at suicide and religious involvement. 141 studies prior to 2010. And of those studies, 75% found that those who were more religious had less suicidal thoughts, made fewer suicidal attempts, and committed suicide less often. And so let me show you some more recent research that has reported similar findings. Here is a study published in the British Journal of Psychiatry. This was over 20,000 Americans. These were randomly picked, identified over 20,000 Americans who were followed for a period of 18 years, looking at the risk of completing suicide. So this is actually the hazard or the incidence of suicide over that 18-year period. Those who attended religious services twice a month or more, those who were involved in the religious community twice a month or more, were nearly 94% less likely to commit suicide during those 18 years. So it appears that religious involvement is quite protective against suicide. Here's another study out of the Harvard School of Public Health. Once again, this was published in JAMA Psychiatry, which is the top psychiatry journal in the world. It used to be called the Archives of General Psychiatry. Once again, those attending services once a week or more were 7 times less likely to commit suicide during a period of 14 years that they were followed. And this is 90,000 women followed during that time. And once they took into account other risk factors for suicide, like depression, medical illness, other risk factors, what they found was an 84% reduction in risk of suicide among those attending at least once weekly compared to those who never attended services. Again, this is a huge sample, 90,000 women followed for a long period of time, and the effects are large. Now, here we're looking at deaths of despair. So deaths of despair involve deaths from alcohol use, drug use, or suicide. And we have a sample here of 66,000. These are women, 66,000. These are all nurses. And they have been followed for a period of 16 years. And they're looking here at the risk of a death of despair. And you can see here among women attending religious services at least once a week, you find that there's a nearly 70% reduction in risk of dying from a death of despair compared to those who never or almost never attend religious services. And So again, this was published also in JAMA Psychiatry, the top psychiatry journal. Now, what about men? We've been talking about women here, but what about men? The findings are quite similar among men with regard to deaths of despair. Again, deaths from alcohol, drug, or suicide. You can see here that there's nearly a 50% reduction in risk of a death of despair among men who have been followed actually over 26 years. So this is 43,000 men, over 43,000, followed for 26 years. And the risk of dying from a death of despair is 50% lower among those men who are attending religious services at least once a week. Again, this is from the Harvard School of Public Health. Now, what about substance abuse? With regard to alcohol use, 86% of these studies, of 278 studies, and again, this is a systematic review that anyone could repeat if they used the same parameters that we used. And of the best designed studies, 9 out of 10 found that those who are more religious were less likely to use alcohol, abuse alcohol, or become dependent on alcohol. Now, what's interesting about these 278 studies is that most of those studies were among young people who have their entire lives ahead of them. Illicit drug use, the findings are virtually the same. 84% of studies find that religious individuals are less likely to use or abuse drugs. And if you look at the randomized controlled trials or experimental studies, you find that virtually all of them find that religious interventions help to reduce the risk of developing and using illicit substances. Here's a study looking at substance use disorder among a large sample, well, not so much, about 500 US adolescents ages 11 to 16 who are at very high risk for developing a substance use disorder. These are children who have been, and teens who have been referred to protective services. And the reason why is because they've been abused in their homes and they've been taken out of the homes. And research has shown that this group of abused young people are at very high risk to develop alcohol and drug use disorders over time. So this study followed these individuals over 18 months, finding that among those young people, those who indicated that religion was very important in their life were more than 50% less likely to develop a substance use disorder over this 18-year period. What about anxiety and post-traumatic stress disorder? So of the studies looking at anxiety, about half find that religious people experience less anxiety. They experience more peace in life. And in terms of more anxiety, 33 studies or 11% report more anxiety among the more religious. Now, one aspect of this review is that of the 33 studies that found that religious people were more anxious, 31 of those 33, virtually all of them, were cross-sectional in design. What that means is that a person, the population was given a scale, a questionnaire, and they filled it out at one point in time, which is not a very sophisticated design. And in fact, many of those studies, because of that cross-sectional design, probably indicated that when people become more anxious, they tend to become more religious. So when you get anxious and worried, what do? You pray, right? You pray that, whatever it is that's making you anxious is going to go away. So that's what I think we're finding, that actually the anxiety is driving the religious involvement in these studies that are reporting a positive association between religiosity and anxiety. And of the 40 experimental studies and clinical trials that have looked at religious or spiritual interventions, 3/4 of them find that those interventions reduce anxiety symptoms. Now, here's a study of United States veterans. These are war veterans. This was a random sample of over 3,000. This is a cross-sectional study, but the findings are that lifetime PTSD, now religiosity in this study was measured by 5 questions. The 5 questions were religious attendance, frequency of prayer or scripture study, Bible study, and 3 questions about how deep and strong was the person's relationship with God. And so what this study did was it divided the total score on this scale, between those who scored in the upper half, those in the high range, and those in the low range. And then they compared lifetime PTSD, lifetime major depression, lifetime alcohol use disorder, and then also current post-traumatic stress disorder and current alcohol use disorder. You can see from these odds ratios that those who scored high on this religiosity scale were more than 50% less likely to experience a lifetime PTSD. They were 50% more or less likely to experience a major depression during their lifetime. They were about a third less likely to experience an alcohol use disorder. And in terms of current, post-traumatic stress disorder and current alcohol use disorder, they were 70% likely to experience a current PTSD and more than 70% less likely to experience a current alcohol use disorder. Again, these are U.S. veterans that are at high risk for developing mental health problems and alcohol use disorders because of the trauma that they've experienced during war. Now, what about we've been talking about negative aspects of mental health, depression, anxiety, suicide, substance use. What about the positive aspects of mental health, well-being and happiness? So the findings are even stronger with regard to well-being and happiness. Of the 326 studies published prior to 2010, nearly 80% found that religious people are simply happier. They experience greater life satisfaction, greater well-being. And of those 326 studies, only 3 studies found lower levels of well-being among the more religious, less than 1%. So there are literally 80 times more studies finding that religious people are happier and more fulfilled in their life and have greater well-being than those studies finding lower well-being. That's a lot of evidence in favor of the idea that religious involvement helps people feel more fulfilled in life, happier. Now, part of that may have to do with it gives the person a sense of meaning and purpose, or a sense of hope, or a sense of optimism, which the research seems to show it does. So of the 45 studies, quantitative studies, published in peer-reviewed journals, 93% of those studies found that religious people have greater meaning and purpose in life. They have greater hope in 73% of the studies, greater optimism in more than 80% of the studies. And these findings are extremely important because they have consequences for a person's recovery from physical illness. If a person is more motivated to care for themselves, if they have more hope and they're more optimistic about recovering from an illness, they're going to do better. We know that from research in rehabilitation and recovery. Okay. What about social support? So religious people in over 80% of studies have more support. They have more friends. They have more contacts with people. They just have more support from other people, especially when they get sick or when they go through trauma, as opposed to those who are less religious, who have fewer, lower levels of social support from friends and family. And part of that has to do with the fact that most religions encourage people to love one another, love your neighbor. And as a result, a person has more neighbors that are willing to support them if they're more religious. Delinquency and crime. Not surprisingly, of the 144 studies, close to 80% found that religious people are less likely to, young people are less likely to commit delinquent acts. And when they become adults, they are less likely to be involved in crime. And that makes sense because religious organizations tend to promote moral attitudes and behaviors and high values and ethics, so all of that has consequences in terms of young people's behavior, both earlier in life and later in life. And marriages appear to be more stable and more satisfying among those who are more religious, those who pray together, those who attend religious services together. And again, this is based on secular scientific research. 86% of quantitative studies report that religious families, there's less divorce, there's greater satisfaction, there's less spousal abuse, less cheating on spouse, more likely to have an intact family with two parents in the home in the overwhelming number of studies that have looked at this. Here's a more recent study, 2018, again, out of the Harvard School of Public Health. And in this study, they followed 66,000 initially married women, and they followed them over 14 years to see whether or not they separate from their husbands or become divorced. And what they found was, once again, there's a nearly 50% reduction in risk of divorce or separation among those who are attending religious services once a week or more than once a week. Okay, now this model is intended, it's kind of complex. This is out of the third edition of the handbook that is coming out. It looks at how religious involvement, attending religious services, prayer, scripture study, volunteering for religious reasons, religious education, religious devotion, religious coping, how that influences mental and social health at all different times across the lifespan, from the prenatal environment all the way up to a person's later life and as they become close to death. So here are all of the mechanisms. Maternal stress and substance use are lower among women who are more religious, as we saw earlier here. Religious families tend to be more nurturing. They tend to value having children more. That's why religious families tend to have more children. There is more training of the child in terms of morality and ethics, and the children are monitored more closely. Children of religious families, they don't get away with things as often as do children of families that are not as religious. Also, religion helps to prevent trauma and various losses because of bad behavior. Religion encourages a positive view of life and better coping by a healthier worldview. And also, it encourages pro-social behaviors, healthy lifestyle, exercise, better diet, and less smoking and less drugs and alcohol. And religious people tend to make better decisions that are more pro-social and healthier decisions. And again, tend to have higher virtues that they seek to abide by and seek to develop their character. Now, of course, all of this is influenced by genetics and these epigenetic influences, which is a combination of the genes and the environment, the effect that the environment has on genetic expression. So that there's some biological predictors of mental and social health as well that are independent of the effects that religious involvement has on mental health. So let's quickly look at physical health here. So in terms of, I said earlier that religious people are less likely are more likely to live in a healthier way. And that's true based on the systematic review in the second edition of the handbook. 68% of studies show that religious people are more physically active. They're just more, they exercise more. They're more physically active. There is, as I said earlier, there's less extramarital sex, safer sexual practices, and in 86% of studies. And in terms of weight, well, weight. So now we have we have a condition that religious people basically, I have to admit, religious people tend to be heavier. They eat more. They have a healthier diet. Research shows that religious people eat more healthy food, but they eat too much of it, unfortunately, and they tend to be overweight. So eating tends to be one of the things that religions encourage and support. And so there's some work that needs to be done there. Okay, cigarette smoking, 90% of studies show that young people are less likely to start smoking and to continue smoking, 122 of 135 studies. So all of these studies are published in medical, psychology, nursing, and public health journals. You can go to these studies, you can look at the findings, and they're all in the second edition of the handbook. Let's look at physical health, because mental health and behavioral health and social health affect physical health as well. So let's look at this. Better immune functioning in more than half of the studies. So that means during this time of COVID-19, religious involvement helps to boost the immune system, protect us from this virus, and helps to improve the prognosis from the virus if you get COVID-19. Now, of course, there are some factors that are actually affecting your risk for developing COVID-19, because religious people tend not to social distance. They tend to want to hug each other, and that increases the risk of developing the virus. And they, for some reason, they often don't get vaccinated, and they don't get the booster, and they don't get COVID tested. All of that increases risk for developing COVID-19 and spreading it. But they do have stronger immune systems. That's one of the things. Also, research indicates that the stress hormone levels are lower among those who are more religious. And that makes sense, because if religious people are less anxious and less depressed, they're going to have lower levels of stress hormones like epinephrine, norepinephrine, and cortisol circulating in their bodies. And as a result of less stress and lower levels of epinephrine, norepinephrine, they have lower blood pressure in the majority of studies, and better cardiovascular functions, higher heart rate variability, lower cardiovascular reactivity, and lower levels of chemicals in the blood, such as C-reactive protein, that increase inflammation and increase risk of coronary artery disease. And consequently, almost 2/3 of studies show that religious people tend to have lower levels of heart disease when studied both cross-sectionally and over time. Here's the recent study, again out of the Harvard School of Public Health. This was published in the American Journal of Epidemiology, which is the top public health journal in the world. And they looked at 44,000 women over 12 years, and they found that the development of hypertension was about 10% lower among those who are attending once a week or more, attending religious services. So there's a 10% reduction in risk of developing self-reported hypertension, which is quite substantial. Also, in terms of, if you have high blood pressure, you're going to be more likely to die of a stroke, of cerebrovascular disease. And so this is another, this was published in JAMA Internal Medicine, 74,000 nurses followed for 16 years. You can see here that the risk of dying from a stroke is substantially lower among those attending religious services, really pretty much to any degree compared to those who never attend religious services. And in terms of coronary heart disease, here's a recent study looking at the relationship between religious involvement and the development of coronary heart disease. There's actually a cross-sectional study, so it's a case control study. But those who overall, now this is out of Iran, so these are all Muslim patients. You can see here there's a dramatic drop in the risk of having coronary heart disease among those who are more religious. Now, in terms of mortality tends to be a very good outcome to study because it is the cumulative effect. It's an indicator of the cumulative effect of living a religious life over the person's lifespan. And of the 120 studies that have examined the relationship between religious involvement and overall length of life, nearly 70% find that religious people simply live longer. They live longer because, they are mentally healthier and they're physically healthier and they live a healthier life, and consequently they live longer. And the length of life that religious involvement adds, particularly being involved in a religious community, is anywhere between 7 years and 14 years. That depends on your ethnicity, and it's based on studies here in the United States. Those who are white people live 7 years on average longer, and African Americans or Black people live 14 years longer if they are regularly attending religious services and involved in the religious community. So religious involvement seems to really make a difference in terms of your health. Here's a study out of the Harvard School of Public Health. Once again, the Harvard School of Public Health is one of the top schools of public health in the world. They have an incredibly good reputation. It's coming out of Harvard, very reputable institutions, research institutions. And so in this particular study, you've got almost 75,000 nurses. This is published in JAMA Internal Medicine. And this is all-cause mortality. And among those attending religious services, at least once a week, you've got about a quarter, there's a reduction in likelihood of dying from anything. That's anywhere between 25% or 26% and 33%, depending on religious attendance, compared to those who never attend religious services. And this is true for cardiovascular disease and for cancer mortality as well. And these are significant, highly significant findings from this research study. And again, you can look this up. Just go to JAMA Internal Medicine, and it was done in 2016 if you have any questions about the details. And here's another study more recently, just within the last couple of years, looking at the risk of a cancer diagnosis among a group of young people. This is 10,000 young people, average age of 23, who are followed for 3 to 6 years. So young people typically don't get cancer. But in this study, the risk of cancer was substantially lower, was 2/3 less likely among those attending religious services at least once a week. And these are young people, average age of 23. Okay, so basically, here's a summary. I want to get to a point where we can have questions. Here's a summary of all of the research. Basically, what you got here is these are the number of studies, quantitative studies. This summarizes the findings from the first and second editions of the handbook. You've got complex findings in about 100 studies, which means that it was hard to determine what the finding actually was. You've got, nearly 250 studies showing that religious involvement is related to worse health. That NG means negative, and it's significantly worse health. And again, many people turn to religion when they get sicker. That's what that reflects, probably. You have a trend in that direction in a few studies. you have mixed results depending on the religious measure. It may be positively or negatively related to health. And you've got a couple of hundred studies here with regard to a trend towards positive health, but you've got a whole lot more studies, nearly, we're looking at here like 2,300 quantitative studies reporting that religious involvement is associated with better health across the board. And then a few hundred studies finding no association. And this is everything that's been published in the medical literature, psychological literature, prior to 2010, in the first couple editions of the handbook. So this is how we try to understand this. So this is a model. This is out of the third edition of the handbook. The source of the health benefits for monotheistic religions. So this is a description for monotheistic religions. We also have models for the Eastern religions and for secular humanists, but this is the one for Christianity, Islam, and Judaism. So the source of these benefits is belief in and attachment to God. Belief in and attachment to God. That's what generates all of these health benefits over time. And this is manifested in terms of the theological virtues of faith in God, hope in God, and love of God. And this is nourished within a religious community, and it's also affected by peer influences, education, and training. Consequently, this will result in various levels of public religious practices, of private practices such as prayer and Bible study, or study of the Quran or the Torah, religious commitments of various degrees, religious experiences, and religious coping. All of this then influences human virtues such as forgiveness, honesty, self-discipline, altruism, generosity, humility, gratefulness, patience, and dependability, because these are the human virtues that religions encourage. They also influence decision-making and healthcare behaviors and health maintenance and screening and compliance with treatment. All of this influences positive emotions, social connections, and negative emotions. Now, admittedly, there are also secular sources of encouragement of human virtues and of decision-making and health behaviors. So we acknowledge that. And all of these behaviors and these emotions affect the nervous system, the immune system, the endocrine system, and cardiovascular functions, all of which affect physical health and longevity. And this entire model then is based on, well, it's affected by a person's genetics, their developmental experiences, and their personality. So those are factors that influence this entire model as well. So applications in healthcare, physicians should take a spiritual history, talk with patients about these issues, respect, value, and support the beliefs and practices of the patient. It has to be patient-centered. Identify the spiritual needs of the patient and then get someone to meet those spiritual needs. In other words, refer them to clergy or pastoral care who are trained to address the spiritual needs the patients experience in medical settings. Pray with the patient. If the patient requests a prayer, that's okay. I think healthcare professionals can do that if they want to, but wait until the patient asks you to pray. Don't be asking the patient to pray, because that's kind of coercive. We'd like to avoid that. And then work with the faith community if the patient consents. All of this, all of the clinical applications are in this book called Spirituality and Patient Care that I wrote in 2013. So here's an example of a spiritual history that a physician might take. This is out of JAMA, the Journal of the American Medical Association. It's adapted from that. So here are 5 questions. Do your religious beliefs provide comfort, or are they a source of stress? Because sometimes a person's religious beliefs can cause stress as well, and you want to know about it as a healthcare professional and as a clergy person as well. Do you have any beliefs that might influence your medical decisions? That the doctor definitely needs to know about. Are you a member of a faith community, such as a church, synagogue, or mosque? And if yes, is it supportive? And then do you have any other spiritual concerns that you'd like someone to address? Okay, so again, that would be the clergy or pastoral care or chaplains here in the US. So besides taking a spiritual history, support the religious beliefs and practices of the patient, ensure the patient has resources to support their spirituality, and accommodate the environment to meet the spiritual needs of patients. Now, if you're interested in learning more about this, if you're a physician, if you're a nurse, or if you're clergy, if you're a chaplain or clergy, a pastor or a priest, go to our website. We have 5 videos, 45 to 60 minutes long. They're very professionally done. They were actually done by a Harvard-trained medical media specialist, and it costs well over $100,000 to make these videos. They're all free if you want to learn more about how to integrate this into patient care. So in conclusion, religious involvement is related to better mental, better social, and better behavioral health, and improves these health outcomes over time. Now, as religious involvement lessens as a result of increasing secularization, we have seen in the United States crime rates, alcohol and drug use, and addiction all increasing. Religious involvement is also related to better physical health, less functional disability, and less cognitive decline with aging. There's all research showing that. I didn't have time to present that. These findings have huge implications for public health and healthcare costs as religious involvement becomes less common with each younger generation. So we need to get the younger generations here motivated to be more involved in their religious communities, because that's going to affect their health and the cost of healthcare, both mental health care as well as medical care. So the clinical implications or applications of the research on religion, spirituality, and health are vast in terms of provision of mental and physical health care. So now, if you want to know more, here's the book on integrating spirituality into patient care. You can get it on Amazon. We'll send you a free monthly e-newsletter if you want to sign up for it on our website down here. Sign up for it. It's got the latest research, the latest news on religion and health, resources that you can turn to learn more about religion and health, various lectures and conferences, various funding opportunities if you actually want to do research in this area. So all of this is free. Just go to our newsletter. I spend a couple of days every month writing this e-newsletter, so it's got the latest research and findings in it. Now, if some of you want to visit us here at Duke University, we have a 5-day summer research workshop. And we've had clergy come, we've had professors at Harvard come, Stanford, Johns Hopkins. We've had high school students come to this workshop. Everyone seems to really enjoy it. And we have professors from Duke, Yale, Emory, and elsewhere come and give talks. And there are some partial tuition scholarships available as well. If you have any questions about this, don't hesitate to email me at harold.koenig@duke.edu. And if you can't come to the workshop and you still want to do research, here's a book you can buy, this 2011, that is kind of a summary of the workshop. And then finally, here is our website address, spiritualityandhealth.duke.edu. Okay, so we have about 7 minutes for questions.
Thank you so much. Thank you so much. We are so impressed with the data you presented, and we thank you especially for the practical suggestions to join and learn more and be more acquainted about this so sensitive and so important for all of us. So quickly, have you find some questions? Have you find differences amongst Christian churches and non-Christian, Muslim, Buddhist, Jewish, other?
Okay, so most of this research has been done within Christian populations. So probably 90% of it comes out of samples who are Christian. So we know that these findings apply to Christians in general. Some of the studies, though, find similar findings among Muslims and Jews, and even some similar findings among Hindus and Buddhists who are devout believers. So it's more a matter of how devoutly do you believe and do you practice your religious faith. That's the important thing. But we certainly can apply these findings to the Christian population simply because that's who's been studied primarily.
The other question reads, amongst Christian churches, Orthodox supports that theosis, approaching God, can be succeeded by being part of the community. Protestants and Catholics support individual efforts. Have you studied these groups? And if not, do you think this might show different results?
Well, I think there's no question that being part of a faith community is extremely important. You know, throughout this talk, you've noticed that the majority of these studies are looking at level of involvement within a faith community. So that is of critical importance. If people are isolated from each other and they're just praying at home or just reading the scriptures alone, that's not going to have nearly the benefit as participating in a faith community. So that we know for sure.
Thank you. In all of your years as a researcher studying the relationship between religion and health, what was your most surprising finding?
You know, Dr. Linus, the most surprising finding was that we could actually do this research and find a significant relationship between religious involvement and health. And the reason I say that is because this relationship is very complex. You know, people turn to religion when they get sick. And so if you study people over time, it's hard to show that religious people are actually healthier. Again, because religion is a behavior that people mobilize when they're in trouble, when they're stressed, when they're sick. And so it's hard to actually look at that relationship. We think, though, that given that we do find all of these significant relationships, that we're only looking at the tip of the iceberg here. As we refine our methods and do better research, we think that these findings will even be stronger than we've already found.
Yeah, and then the last question, of all indicators of religious involvement, what is the most powerful predictor of mental and physical health?
Once again, no question about it, it's involvement within a religious community. It's attendance at religious services, but it's more than that. It's involvement in the community in terms of volunteering and participating. All of that logically and rationally increases a person's sense of meaning and purpose, increases their connections with others, improves their mental health, enhances their social support, and it helps to affect their health behaviors and physical health as well. So it's religious community involvement. That's what counts.
Thank you so much, Professor Koenig. And we all here in Greece hope to see you in person in the near future in Greece. So put that in your calendar.
Thank you, Dr. Linus.
Thank you very much again. And thank you to all listeners. Bye-bye.
Bye-bye.